suffer from an eating disorder in the United States. Every 62 minutes, at least one person dies as a direct result from an eating disorder. That's almost one person an hour, which, if you do further math, that's almost 24 people a day that die because of an eating disorder. Roughly 10% of the population of the United States of America is afflicted by some form of eating disorder or another. So when you look at this problem, it's pretty obvious to see that this is an interdisciplinary problem. This is not something that's easily fixed. There's a solution that can just be came up with, right offhand. This is the problem that has been plaguing people for years and years and years. The reason that this issue is an interdisciplinary issue is for many reasons. If you look at them, eating disorders affect the brain just as much as they do the body. Most people, when you think about an eating disorder, you think about the purging and the extreme dieting and things like that. But in fact, it affects the brain just as much, if not more, than the body. For instance, a person with anorexia will also show an intense fear of gaining weight or becoming fat. And if that fear isn't shown, there's still a persistent behavior that interferes with weight gain, even though the weight may be significantly low. While suffering from anorexia, a person also has a hard time recognizing the seriousness of their condition, the seriousness of their weight loss, or they're unable to see, like I said, they're unable to see how thin or underweight they are. These people are very reliant on the shape of their body and the scale. These kind of people mainly rely on that number on the scale. In about 50% of cases, those with an eating disorder are also plagued with some other form of mental disease or mental illness. And 50 to 80% of those at risk for anorexia or bulimia is because of genetics. It's a genetic precondition that gives them this possibility of having these issues. There's also the fact that certain psychological factors and personality traits may predispose people to having eating disorders. In fact, actually, a wide range of situations can precipitate eating disorders in susceptible individuals. Family members or friends can pick on these people for their weight, or small things, and it just kind of adds up over time. Or it can be something as simple as an athlete or a gymnast participating in a sport that requires them to keep a certain physical condition or keep a certain weight. Things like that can instigate these types of illnesses. Negative emotions or traumas such as rape, abuse, even death of a loved one can actually cause these types of illnesses to come about. And it's not always negative. Positive events can actually cause eating disorders to manifest, such as giving birth. That's actually a very large cause of these types of things, because when you go through the birth process, your body changes, and there's a lot of things like that. And you've got postpartum depression that comes into play here as well. So it's these illnesses. It's not just always about just the overall view of the body. There's a lot of factors that play into these kinds of things here. When you look at the interdisciplinarity of this problem, obviously you've got to have multiple disciplines here that you're going to tackle this problem with. Personally, when I looked at this, the first couple of disciplines that came to my mind were psychology, nutrition, and then overall health as a whole. Looking first at psychology, like I stated earlier, the brain is the one that is, surprisingly to some people, what's under attack, not so much the body. The body is merely an innocent bystander. The brain is the one that's forced to take the brunt of the abuse. that to a passenger in the car with a drunk driver. The passenger is merely an unfortunate traveler. They're trapped in the car with the drunk driver, much like the brain. Much like the body. The body is the innocent traveler. It's trapped. It's at the mercy of the brain in this instance. For those with an eating disorder, they have a distorted view of reality. They see what isn't there, kind of like a funhouse mirror. They may look in the mirror and what they see isn't what's really there. And also, in relation to the psychology, those that battle an eating disorder often battle some other form of mental illness, such as depression or an anxiety disorder. It's also common for those battling an eating disorder to also be battling some other form of substance abuse, such as alcoholism or drug abuse. And in recent studies, it's been shown that deficits in social cognition found in anorexia nervosa are similar to those patients of neurodevelopmental disorders, such as autistic spectrum disorders. So as you can see, these types of disorders are very much linked to the brain and very much linked to issues with the brain, with the processes and things like that. So it's deeply linked in there. It's not just something that lies around on the surface. Moving on to the discipline of nutrition. This is kind of where it gets a little fuzzy when you're trying to relate these disciplines together, because when it comes to nutrition, nutrition has actually often been neglected, because most doctors and experts are under the assumption that the disturbance in the eating behavior is a secondary feature of the illness, that if you correct the mental aspect of the disorder, that the nutrition will kind of even itself out. But this is actually not the case. In the research that I conducted and looking over everything, I found that it was actually determined that the side effects of these disorders, such as the starvation and anorexia, they have to be corrected before the patient can actually successfully go through psychotherapy or counseling. They can't be regarded as features that will spontaneously just correct themselves. It doesn't work that way. The last discipline, health, it's a huge factor. It's almost as much as psychology, because when you look at health, these types of eating disorders can wreck the body. Anorexia adversely affects almost every body system. You get these disorders. Dysphagia can frustrate the ingestion of oral calories during the early stages of refeeding. When these people are trying to recover and refeed themselves, it's due to a weakened and uncoordinated pharyngeal muscles, which as a result, these patients often experience coughing fits and aspiration pneumonia. You can also get symptoms and issues like brain atrophy, thyroid function abnormalities, osteoporosis, or death. Actually, anorexia has the highest mortality rate of any psychiatric disorder, any at all. Sudden cardiac death and other major medical complications, to include suicide, account for approximately 60% of the deaths with psychiatric disorders. That's quite a few. So kind of to go back over everything, to speak on the interdisciplinarity of the situation, as you can see, with the issues with the brain and the body as a whole, and the side effects, the different diseases and whatnot that these can cause, like the osteoporosis, the brain atrophy, the thyroid issues. So if you combine those with the problems with the brain and the problems with the diet and whatnot, you've got a very complex problem there. It's not one-sided. It's very multi-sided. And as someone who can speak on this from personal experience, someone who has battled these issues, someone who has battled an eating disorder, I used to be 300 pounds, and so I kind of got to a point where the realization first, it started out very unhealthy. I was going down a very dark road. So I started dieting, I started exercising, and as the weight came off, it almost became an obsession. Um, it was something I looked forward to every day, every morning. I would step on the scale. Every afternoon, if I was home, like on the weekends, I would step on the scale. I would step on the scale in the evenings. I would step on the scale after meals. It became compulsory. I had to see that number, and that number had to go down. And if that number didn't go down, I was very disappointed and very upset with myself. So it got to the point where I started really restricting my calories, really restricting my intake to make sure that I met that lower number on the scale every single day. But with that restrictive diet came binge eating. I would get these episodes where all day long I would eat great, I would follow my diet, I would be on path, and then at night I'd get hungry and I would just almost lose my mind, and I would start eating and eating and eating, and it wasn't even necessarily that I wanted to eat so much as I felt the compulsion to eat, that I felt like I had to eat. And I would just keep eating and eating and eating and eating to the point where I was no longer even slightly hungry, but I just felt this need to continually eat. And then after these episodes of these binge eating, I would rely on laxatives, or I would make myself throw up to try to clear out, this one. It sounds kind of funny, but I would call it my demon. Like I had to get this demon out of me, and that's how I felt. And that's something I still struggle with. Actually, this deployment has helped me quite a bit with that issue, but it's a very complex problem. It's not something very easy. So I kind of have a personal aspect here. I personally know that this is not something that's simple to fix. It's not something that's easily, oh well, I'll just eat healthy and that'll fix my problem. No, it's a brain problem. When you look in the mirror, what you see is not what other people see. People can tell you all day long, oh, you're so skinny, you look so good, but if that's not what you see in the mirror, that's not what you're going to believe, and so your compulsions are going to feed off of what you see, not what others tell you. So in conclusion, as you can kind of see from what I've explained, the problem is most definitely a complex problem. In fact, it might actually be a wicked problem. Coming from experiences, it can be beaten, absolutely can be beaten on a personal basis, but on a societal level, I don't know if there ever is really a solution. And if there is a solution, it is most definitely a long way off, because you've got a lot of areas to tackle. You've got genetics, you've got nutrition, you've got psychology,